So good afternoon, everyone. Thank you for joining us today. My name is Dr. Rajani, and today for our question and answer, we've actually got a mum and daughter pair who have kindly agreed to speak to us about their experiences with the cervical cancer screening program here in the UK. Thank you, Anita and Lina, for joining us today. I'm just going to start off with quite a broad introduction, really. So if you don't mind telling us, Lina, how old you are and how you actually learned about the cervical program in the UK.
So I'm 25 and I've always kind of known about it because actually a few of my friends are slightly older than me.
Okay.
By a few months. So they'd informed me that they'd gone and had their test done. So that was like, okay, you know, my letter's coming. I know I need to go get mine done.
Okay, sure. Okay. So did you actually receive a letter through the post?
Yeah.
Okay. And you know, and feel free either one of you to answer this, but when that letter came through the post, what was your initial response? So you knew a little bit about the test, but then you were actually invited for the smear test. So what was your initial?
I think I was quite hesitant to get it, not so much in the sense of I didn't want to. It was more so I've heard that it's like either a bit painful or it's a bit like it's a weird sensation. So for me, I was just like, I put it off a little bit because I was like, oh, I really don't want to go do this, but I know I need to go do it. So I think it was more so because I didn't really know how it was going to feel or like what it actually entailed as to why I didn't get it done. But I got it done in the end.
But I think it was more so because initially, you know, the thought in our minds is always that you get this done if you're sexually active. So of course, when she got the letter, she goes, do I have to do this, Mom? And so the initial thing, which I've always thought it's if you're sexually active, you're going to get it done. And I said to her, well, are you sexually active? And, said, no, Mom. So why do you need to do it? I mean, ask the GP, why have you got the letter? And then my older daughter is in the medical profession. She's an embryologist. Okay. And so she sort of, even though she works in that field, IVF and all that, Mom, does she need to do it? And, so we had a family discussion at home about it. Okay. And then I think it transpired that Dr. Desai rang me about Joe's trust. And I asked her the question that, Lina has received this letter, what should we do? And she said, well, cervical cancer is not just about being sexually active. It's also about it gets transmitted in other ways. Mm-hmm. So it is very important that if you get the letter, you get yourself tested. So we had the family discussion. And we said, okay, Lina, you should make an appointment and, you should go and, get it done.
Mm-hmm. Okay, so that was really encouraging. So you sort of got more information about what you were being asked to do. And when you were happy that you qualified, and you could possibly be at risk, you decided that actually the best thing to do was to have the test. Mm-hmm. At that point, did you know what the test involved or?
A little bit. I kind of knew that it would mean that something was going to be inserted inside and whatever, but I didn't actually know the full detail until I made my appointment with the nurse and she explained it a little bit more. And then when I went for the test, they explained in full detail and they made it a very comfortable in like screen like test in as much as they could. Like she said, if it hurts, let me know. Like if you're not comfortable with this, let me know. Like she made it as comfortable for me as possible.
Sure. Okay. And sort of going back to, you said that you spoke about it as a family. That's really interesting because one of the things that we are trying to tackle is getting these discussions happening at home. So do you think that there would be any barriers to maybe somebody within our community speaking about it with Mum and saying, Mum, I've got this letter. And for you, Anita, as a mum, how comfortable do you think women in our community are talking about this kind of stuff?
Well, I personally am very open-minded, and I've always had this relationship with my daughter simply because I had that relationship with my parents. I mean, years ago, my dad was very modern, and we could talk about anything. So my daughters have had the same thing with me and with their dad. They're very open. I mean, the subject, when we discussed the subject, my husband was sitting there as well. It wasn't like, oh, it was behind closed doors, where no men sort of listened to it. So for me, it was easy, natural to talk about it. But I think that barrier is there in Indian communities, that, or you can't talk about it in front of your dad or your brother, or, how dare you ask me this question? And, that I think that barrier still exists.
Okay. And do you think that, Lina, that because your mom was so open about it, did that make you more comfortable about sharing your concerns? And
yeah, I think the relationship I have with mum is definitely not everywhere. So I do appreciate it. And I know that I can talk to mum about it. But I do know that not everyone has that relationship. And it's not always something people like specifically want to discuss, because like my mum said originally, she thought that I only had to get the test done if I was sexually active. Now, a lot of people, like daughters, may not want to tell their parents, okay, yes, I'm sexually active, I might need to get this test done. Or even if they're not, it's not particularly a comfortable subject that you really want your parents like to discuss it with.
And you mentioned at the start that you knew friends that had it. So what could say there's a young girl listening to this today, and she's thinking, okay, I don't have that relationship with my mum or dad. Do you think that maybe friends are a possible source that people could?
Yeah, friends are definitely a good source, especially those that you're very like quite open with, things that you tell them that you wouldn't necessarily tell your parents. So I would definitely say, if you're not comfortable speaking to it about with your parents, friends are always going to be there.
Or older sisters.
Or older sisters, yeah.
Okay. And then you mentioned, the nurse made it very, as comfortable as possible for you. Looking back now, do you think it is an important test to have?
Definitely. I think as soon as like someone does get the letter, it's definitely something that they need to book in as soon as possible. It's like a 5-minute appointment that can be done and dusted. And it's important because you need to know if you may have any cells that are like related to cervical cancer, or if it's just a necessary checkup. And it's just once, I think every 3 years?
Yeah. Okay. Yeah. So you're correct. So once you're invited, initially it is every 3 years, unless obviously, there's a there's something that's found on one of the results, in which case they might need to increase the amount of surveillance. So tell me a little bit, so you were brave enough to go have your test, you had a good relationship with the nurse that meant you were at ease. Tell me about the period after. So you had the test done and now you're waiting for the results. How did you sort of manage that time of waiting for the results?
I think I'm the wrong person to ask, because I'm quite laid back and I'm quite just a bit blasé about it, in the sense of I've had it done, I'll just wait for the results. And if I'm being honest with you, I forgot about the fact that I was waiting for the results. And then when I got the letter through, I think it was 3-4 weeks later, and I was like, oh yeah, I remember having this done. They've sent me the results, like, okay, it's all fine, it's clear. But I do know that other people will stress about it, especially if it's something that may potentially run in the family. And I think, like we've said, having a good relationship, even with friends or like family, just being able to try and talk to them and discuss it with them, or even if you don't want to think about it, like you can always just, watch Netflix or something just to keep your mind off it. And that's how you could deal with it.
Oh, okay. No, that's really positive to hear, that it doesn't necessarily mean that if you have the test, you're going to be worrying about it. Some people won't. Mum, for you, was it that she's had the test now? What will the results be? Or did you have a similar attitude to Lina, that, okay, the
I
test
think
is
in
done?
our family, everyone has that attitude.
Okay.
That we've gone and got ourselves tested. Doesn't matter what it is, but we tend to forget about it until the letter comes in the post. Like I've gone for my breast cancer, the testings, and and I just forget about it, until the letter comes and, oh, you're clear now. So it doesn't, like, I've just because of my age, we've had the bowel cancer done as well, kids.
Okay.
So all that, we just get it done and we forget about it until the letter comes in the post. And because I think our attitude is, why worry about something that you don't know about, or you haven't come across it? Worry when you get that in front of you and say, okay, now is the time to worry.
Yeah. So that's a really encouraging sort of attitude to have. So, already you've discussed, so one of the barriers is actually speaking about it and being comfortable with that. The second is worrying about whether you can handle the results or not. And one of the ideas that you sort of suggested is delaying that worry until you have the results, so you know what to deal with. Was it ever explained to you what the results could show, or was that ever?
That in itself wasn't explained thoroughly. They did just say that if we find some anomaly, we will send you a letter and potentially call you back in for another appointment. But it wasn't necessarily explained as to what anomaly they might be looking for as such.
Sure. Okay. So you were told that, really there would be either a normal test or an abnormal test, and then you would be advised as to what to do if it was an abnormal test. And were you clear about what happens now that you've got a normal test? Was that clear that, you don't need to do anything? Or
yeah, that was clear. They did say that, if it comes back clear, you won't have to do another one for about another 3 years, and then, just keep it going until you don't need to do it anymore.
Okay. And having the experience that you had, so the open discussion before, and then the experience with the nurse to say, make you feel comfortable. Having had all those experiences, looking back now and reflecting on that, how likely are you to continue engaging in the program?
I definitely will, just because I know it will benefit me in the sense of I need to know what my own health is like, what my own body is saying and doing. So for me, I'm definitely going to continue, because it's just something that you just need to get it done. It's not necessarily something that, is going to abrupt your life as such, unless it does come back that you do need to go again for if they do find something. But I think for those who are sexually active, or not even sexually active, just it is important to get it done, because it's your health, really.
Okay, that's great. I think you've both been very, very sort of inspirational. Even as a doctor myself, getting the time to actually have my test is sometimes difficult, but it's really important what you've discussed is having that dialogue, sharing your worries, and making it not shameful to go, like you said, it's part of your body. When you take responsibility for it, that puts you in the driving seat. So I think hopefully a lot of people today will be listening and thinking, that is a great relationship that we've seen today between mum and daughter, about how supportive you are, and how open you are with your daughter. And I think we can all learn from that there's nothing to be shamed about, to have these tests and be in charge of your health. That's really all I wanted to discuss with you today. On a final note, is there anything that you wanted to say to maybe somebody who's sitting here today, listening, thinking, oh, I haven't had my smear, and they've got that little bit of encouragement from you today? Is there any advice or anything that you would like to say to those people?
Just don't put it off any longer. Just go get it done.
Yeah.
And it just, even if you want to know more about the process, there is no harm in asking the nurse for more information. They're there to discuss it with you. Even if family and friends aren't, just go get it done and talk it about with them.
Yeah, and just to mention, Anita, Auntie, you just mentioned the Joe's Trust. So hopefully, to everyone listening, we'll be posting the link for Joe's Trust, in this presentation. So if you do want to find out more information, so you can have that discussion with your daughters, or your daughters have any questions, then I would definitely recommend that website.
We've already been on that website, because Dr. Desai recommended it. So I've actually been on that website.
Yeah.
And in fact, she also recommended that my son should get that. I think there's a vaccine for boys as well.
Yeah.
So I had a discussion with my son as well,
Okay.
that,
Lovely.
you know, you are under 25, so maybe you should consider then having that vaccine done. So, you know, let's see how he feels about it. But no, Joe's Trust is a very, very informative website.
Great. Okay. Yeah. So we'll be sharing that with all the people watching today. And like I said, you've said it's great. I've been on the website. It is really good. And I hopefully it will help somebody listening today to get some more information.
Thank you.
Thank you.
Okay. Bye. Thank
Thank
you
you
so
very
much.
much. Okay.
Bye.
Bye.
Bye.